I'm here with Dr. Jay Libs of the Libs Chiropractic Center in Pacific Beach. I'm Eric Townsend, and my firm represents anyone injured in an accident by a negligent driver, business, or anyone else that may be responsible. The most important and critical step in their case is proper treatment and getting them healthy. That's why I brought on Dr. Jay, so he can explain how his business is operating due to the coronavirus outbreak. Thank you for coming on today, Dr. Jay. With the coronavirus pandemic going on, what advice can you give my clients?
Thanks for having me today. A few things. Definitely stick to the CDC regulations. Stay away from people as much as possible. Wash your hands, drink a bunch of water. Take healthy supplements like echinacea, oil of oregano. We have a few supplements in our office that we recommend also. But the main reason why I am on today is because chiropractors are considered essential services. There's a very specific reason why. First and foremost, is every single chiropractic adjustment boosts your immune system function by up to 200% within the first 3 hours after the adjustment, specifically with a neck, otherwise known as a cervical adjustment. So that's number one. We are staying open because we are boosting our patients' immune systems. We're taking necessary precautions. We're disinfecting. We are limiting the amount of patients that could come in at one time for social distancing. And we're washing our hands between each visit. The second reason is right now the hospitals and emergency rooms are inundated by people that are actually sick with the coronavirus. And patients who have neck pain, back pain, headaches, any sort of musculoskeletal injuries, right now the CDC is like borderline, they're getting close to mandating that those patients do not come into the emergency room. So we, as chiropractors or physical therapists, are essential right now more than ever to help those patients that have musculoskeletal injuries so that the critical care physicians at the hospital and ER can actually help the patients that are in need. That's why chiropractors are considered essential during the pandemic that we are going through right now.
That makes a lot of sense. For my clients, and this is going to be an issue, and I hate to bring it up. I hate to make it sound like we're just concerned about just a case here. It's not just a case, though. We're talking about somebody's health and their well-being. And the reason why it's so important is that they've got to get in for treatment right away. They need to get healthy. That's, like I said at the beginning, you have to be, the most important part of the personal injury case for my clients is getting healthy. Yes. So, it's critical. What do you think in terms of people delaying or waiting to get in for treatment when they've been injured in an accident? How does that affect their case?
Exponentially in terms of two reasons. First and foremost, the assurance adjuster will look at that immediately and be like, there's a gap in care, or you haven't gone for a month, 2 months, 3 months, whatever length of time you want to talk about. Like, you must really not be injured. We're not going to give you any sort of care. That's the first and foremost reason, is you have to show that you're injured as soon as possible to get the care that you are needed via the insurance companies. Secondly, is what you just said, is their health. When it comes to chiropractic, specifically, which is what I'll talk about, the sooner you could come in and the more regularly you could come in, the better. So right now, we have actually limited our office hours because we have seen a massive decrease in our normal patients, and we're actually happy about that. In reference to social distancing. Yes, we want to help as many people as possible, but for our patients that were under wellness care, we told them right now might not be the best time to come in. We wanted to see the acute patients that really need our help right now. And someone who would be one of your clients who's in an injury would absolutely fall in that line. So right now, I'm only open 3 days a week and just in the mornings to limit the amount of exposure we have in our office, but I'm totally willing to go in other hours. Right now we have a case, and I saw him this morning. Today's Tuesday. I'm only open Monday, Wednesday, and Friday. So we are flexible with when we are going to go in and see our patients, specifically for someone who needs it as much as someone in a personal injury case right now. But the sooner you go in, and as we talked about in the past, the more regularly you go in, the quicker you're going to get better.
That's great. And I got to tell you, I appreciate it so much that you put in that time and you do that for my clients and for your own clients, that you make that time for them, especially during this time. It's so difficult for everybody right now to get the proper treatment. Go ahead.
I mean, I have to be honest with you. It's become a moral dilemma of, do I stay open or not? Because we do have to physically be there to see the patients. But my the 2 points that I talked about, how chiropractic is there to boost your immune system, and we are asked by the CDC to stay open to help the musculoskeletal injuries. Those are the 2 reasons why I've stayed open, along with my philosophy that I chose to be a chiropractor to help people. And if we're in a pandemic and people are scared, like, I want to be a source of knowledge and healing instead of vice versa. So we're staying open and we're looking to help as many people as possible. And we are accepting new patients right now.
Awesome.
Whether personal injury or not.
Thank you, Dr. J. I really appreciate that. One last question for you.
Yes.
You guys are open. That's fantastic. The hospitals are open, but we know the hospitals they're trying to serve the people with coronavirus. They're trying to stay open for just emergency services
Yes.
and people that are injured in accidents, and otherwise they may not be getting taken care of that way. In relationship to a patient that's getting treatment through you, and let's say after a couple months, it's clear that maybe they need other treatment. Maybe they need to see an orthopedic doctor, or maybe they need to see a neurologist. Do you know if there are other facilities open, other doctors open, that you can refer these patients out to if they need it, if they need to be sent out, referred out?
That's a wonderful question, and my short answer is I don't know. Since all this has happened, let's call it the last 2 weeks, at least in our world, things have really ramped up in terms of the unknown. I really have just been focused hyper on the chiropractic world, because there are plenty of chiropractors that have closed their offices or limited their hours, or stop seeing patients, stop coming in. So I've been just focusing on that aspect, and not necessarily in terms of what other doctors are open. But I know this for sure. I was just on a webinar right now with some chiropractors, and New York City is like the epicenter right now. It was Seattle a few weeks ago, but now it's New York City. And the governor in New York is asking all retired nurses and medical doctors to please come out of retirement and serve in the hospitals, because the numbers were, they're estimating within the next month, they're going to need 150,000 hospital beds, and they have 53,000.
Wow.
Okay. So not only is that a big deal, but even if they were to get those 150,000 beds that they estimate they will need, they will not have the people to serve those people that are in those beds. So they're asking people to come out of the woodwork. So the reason for saying that is, right now we're not an epicenter. Right now San Diego is generally doing pretty good, but those orthopedists and neurologists that you're referring to, I'm sure that they're staying open for the exact same reason I am.
That's great.
At least I would hope so. I don't know. My answer is I don't know, but I would hope that there are a few offices that are staying open for the medical necessities.
Sounds like we need to get on the horn and check and make sure that we got some of those people out there. Yeah.
Like there's a general practitioner who practices right next to our office in Pacific Beach. His name is Dr. Jim Novak, and he's staying open because he sees a lot of really, really sick people, people with cancer or serious diseases. So he does a lot of IV therapies and ozone therapies, light therapies. So he's staying open because those people, for lack of better terms, they kind of need him to stay alive at this point. So there are definitely medical doctors out there that are staying open. So I would imagine we could find a few.
Good. That sounds great. Well, again, thank you for being there for my patient, for my clients.
Yes.
And thank you for being open to the public and, staying open during this tough time and providing this very important service to our community. So thank you, Dr.
Yep.
J.
Hopefully everyone stays healthy and stays strong. And I'm actually offering, I just posted on my social media today, if anyone wants a free consultation, I'm offering free 15-minute Zoom, FaceTime, or Skype consultations just to discuss their health, anything going on that otherwise they would go to a normal GP for. I'm happy to sit just as we are right now and walk them through some health things that I would recommend.
That's awesome, Dr. J. Thank you so much. I'll make sure my clients are aware of that, and anybody that I talk to that may have a similar issue and needs to see a chiropractor, I'll make sure they talk to you. Thanks, Dr. J.
Here to be a source of health and healing.
Absolutely. Well, thank you, Dr. J. As always, you're a wealth of knowledge, and we appreciate it.
Thanks for having me on, Eric.
Have a good one.
You too.